Well, transference focused psychotherapy is psychoanalytic psychotherapy that utilizes the technical instrument of psychoanalytic technique, in particularly interpretation, transference analysis, technical neutrality, countertransference utilization, and attempts to permit the activation in the therapeutic situation of the split-off internalized object relations of these patients, interpreting each of those that become dominant in the interaction in terms of the self-representation and the object representation activated and played out respectively by patient and therapist, considering that when these internalized object relations are split, they rapidly tend toward reversal of roles in terms of the patient not only enacting the self-representation, projecting the object representation onto the therapist, but identifying with the object representation and projecting the self-representation on the therapist. We try to analyze systematically these internalized object relations that rapidly can be divided into idealized all good ones and persecutory all bad ones, and that initially are split from each other. And in each of these idealized and persecutory segments, we try to analyze the role reversals that the patient carries out, the objective of which is the gradual developing awareness on the part of the patient that he really harbors identification both with self and the other of the interaction, which makes it less frightening in the case of the persecutory relationships and makes it less of an unrealistic idealization in the idealized one. Over time, as the patient has a better tolerance of the awareness that he incorporates these mutually split-off relationships, we interpret the defensive function of those splitting operations in order to integrate them, permit a passage, if you want, to incline a language from a paranoid schizoid position to a depressive one, gradually obtaining integration of total object relation, tolerating that the self is both good and bad and others are both good and bad, leading eventually to an integrated sense of self and an integrated sense of significant others, in other words, to normal identity formation, which is the strategic objective of the treatment. We want to transform borderline personality organization into normal identity by this method. So strategy consists in permitting the activation of these object relations, gradually interpreting them. The techniques are the use of the psychoanalytic techniques that have certain differences from the way in which they are applied in standard psychoanalysis. And then we have a number of so-called tactical maneuvers, which is dealing with frequent complications, psychotic regressions, severely paranoid regressions in the transference, affect storms, acting out, repetition compulsion. And the complications in the behavioral complications in terms of eating disturbances, antisocial behavior, various degrees and types of depression and anxiety. The external organization of the treatment is 2 sessions per week, 45 minutes each, so the frequency is significantly lower than that of psychoanalysis, higher than that of many types of supportive or brief psycholytic psychotherapies. And we try at the beginning of the treatment to create a specific frame that consists of a task given to the patient, free association, and an attitude of the therapist, evenly suspended attention, modification to some extent of Beyond's recommendation to intervene without memory nor desire. I think that in essence describes the treatment.